Now that we've learned about the male and female anatomy, let's talk about what happens when these two come together. Fertilization and pregnancy are terms that sometimes are used interchangeably. However, it's important to note that these terms are separate and that their definitions be respected. Let's define these two terms and understand why they're not the same thing. Fertilization, as we've mentioned before, refers to a sperm and egg coming together and forming a zygote. This again normally happens in an oviduct, meaning it's happening in the tube leading from the ovary to the uterus. Pregnancy, on the other hand, does not start until the embryo has implanted. This usually takes 6 days after fertilization. So fertilization and pregnancy are not necessarily the same thing. We want to make that distinction because as we talk about later topics on the reproductive system, having this distinction is extremely important. Let's look at some common birth control methods, since not everyone is trying to get pregnant if they engage in sexual intercourse. The most accurate way to prevent yourself from getting pregnant is to just not engage in sexual intercourse in the first place. We call this abstinence. However, while it is 100% useful at preventing pregnancy, it's not always something someone wants to do. Most people in their lives will engage in sexual intercourse at some point, and most people who engage in sexual intercourse will do so without the intention of becoming pregnant. So while abstinence is 100% effective, it's not the most realistic, lifelong form of birth control. Let's look at some other ways that we can control for birth and control for pregnancy while still being able to engage in sexual intercourse with partners. Hormonal control is a very popular method of birth control. Hormonal control involves things like birth control pills, contraceptive injections, and contraceptive implants. All of these are using hormones that can help block things like follicle stimulating hormone and luteinizing hormone to prevent a follicle from developing and to prevent ovulation. That is the main goal of hormonal control, is to prevent ovulation from happening. If ovulation does not occur, then there is no egg to fertilize. It is important to note, though, that hormonal control only prevents pregnancy. It does not protect someone against STIs or STDs. Barrier methods include IUDs, condoms, and diaphragms. Barrier methods are tools that are used in order to physically block the sperm from getting to the egg. An IUD, or an intrauterine device, is a small piece of plastic that is inserted into the uterus to prevent implantation. So ovulation still happens, and fertilization may still happen as well, but it just cannot implant into the uterus. Some of these may have hormones involved as well, and others may be non-hormonal and contain things like copper. Condoms, both male and female, physically block fertilization. You're probably more familiar with a male condom. The male condom will be worn over the penis and prevents the sperm and prevents the semen from ever getting inside the female reproductive system. A diaphragm is another physical barrier method that involves a latex cup that covers the cervix. So while sperm may be in the vagina, they are stopped right there and cannot get any further. Since the sperm cannot get towards the uterus and in turn into the oviduct, they're completely unable to fertilize those eggs. The most permanent methods of birth control are sterilization. Someone who undergoes sterilization is looking to not have children ever, and sterilization is a method used both in males and females. In males, we call this a vasectomy, where the vas deferentia are cut and sealed. This prevents sperm that are produced in the testes from ever exiting out the body. Sperm will still be produced, and sex hormones are still produced. They just can't leave the testes. In females, this is known as tubal ligation, which consists of cutting and sealing the oviducts. So while the ovaries will still go through the maturation process for an egg and will still produce hormones, the egg can never get to the uterus and sperm can never reach the egg. Hence, fertilization never happens. However, it's important to note that these two decisions, these two processes, these two procedures are relatively permanent. And so great thought must be put into whether or not a person should have this done. Here's some of the common birth control methods and what they look like. We have the intrauterine device, the IUD, and you see how they have various shapes and sizes. We have a female condom, which would then go inside of the vagina, and the more popular male condom, which is worn over the penis. Sterilization is a more permanent solution to this, in which case the vas deferens are cut, meaning the sperm produced inside this testis cannot leave. It cannot get up and join in with semen production. A male who's undergone sterilization will still be able to produce testosterone. They still will be able to produce sperm, and they still will produce semen. The sperm just cannot become part of the semen is all. And so a man who undergoes sterilization will still be able to ejaculate. He just wouldn't find any sperm in that ejaculate. In the female reproductive system, the oviducts are cut. So any egg that matures from an ovary has no possible pathway towards the uterus. And sperm who may arrive can get into the uterus but cannot reach the egg. They're physically blocked and will never meet, and fertilization is prevented. All of the types of birth control we had talked about up until this point were preventative measures. There's one other preventative measure that can be used. Previn, or Plan B, is known as the morning after pill. It can take a little while for fertilization to even happen, and we know that implantation takes at least 6 days. So the morning after pill, or Plan B, upsets the normal uterine cycle so that the embryo has a really difficult time implanting. This is about 85% effective, and it's more effective the sooner a person takes it after intercourse rather than later. Something like RU486 or mifepristone, however, is an abortifacient, meaning it will cause a loss of an implanted embryo. This is where our definitions of fertilization and pregnancy become very important. Fertilization is simply sperm and egg have come together. However, our developing embryo has not implanted. There is no pregnancy with fertilization. And in fact, many, many times, a woman may experience fertilization and not even know it because it never succeeds at implanting. Mifepristone, on the other hand, will destroy an embryo that has already implanted. Mifepristone is used for an individual who is already pregnant. And remember, pregnancy is the term that we use to describe an implanted embryo that is developing in the uterus. Mifepristone is 95% effective at ending a pregnancy. Whether or not you feel that these are appropriate measures is not something we will go into in this class. However, I bring these things up because it's important for us to be informed about what the biological definitions are and what is happening when different types of birth controls are used. Sometimes, though, people are actively trying to get pregnant and yet can't. These are people we would say are infertile. But what does infertile mean? Infertile doesn't necessarily have the end-all be-all term you think it is. Infertility is simply the inability to achieve pregnancy after 1 year of regular unprotected intercourse. That means that a couple have been trying to achieve pregnancy for 1 year on a regular basis and have not become pregnant yet. It does not mean that a person will never become pregnant. It simply means it's been more difficult for that couple compared to the average. And there are many things that can lead a person towards infertility, including obesity, low sperm count, blocked oviducts, and a condition known as endometriosis. If someone is infertile, there are many different options for those individuals. There is adoption, which is legal custody of a non-biological child, meaning that you legally gain custody, you legally become the parents of a child that is not biologically related to you. For those who do want to become pregnant themselves, there are assisted reproductive technologies as well, including artificial insemination by a donor, meaning a sperm donor is used to place sperm inside of the vagina by a trained physician, and in vitro fertilization, or IVF, where sperm and eggs are taken outside of the body and fertilization happens in lab equipment. The embryos are allowed to develop to a certain extent and then are transferred back into a woman's uterus to implant. There's gamete intrafallopian transfer, or GIFT, which is similar to IVF, except the eggs and sperm are placed back in the oviducts as soon as they are fused. Surrogate mothers, which are women who are legally paid to have babies for someone else. And intracytoplasmic sperm injection. When a man has infertility problems like low sperm count, this is one of the methods that can be used, where they take a single sperm and inject it directly into the egg and then go through the IVF process. However, there are drawbacks with infertility. These procedures typically have risks. These involve surgery and collection of eggs that can damage organs and cause bleeding. Many of the fertility drugs that are used can have side effects, which some can be life-threatening. And IVF usually creates many more embryos than are needed. What do you do with those embryos? Sometimes they're frozen for later, sometimes they're donated, but many others are destroyed. This is something that some people find offensive or upsetting. Whether or not you do is not something we're going to get into. However, it's something to think about. There's also a significant increase in multifetal births, meaning twins, triplets, or quadruplets, and that can result in a difficult pregnancy as well as complications. Going back to IVF, there's important legal consequences as well. If there are embryos that have been frozen and that couple were to divorce, what would you do with those eggs? What would you do with those embryos? I won't tell you what to think on this, but consider all of the options and consider all of the gray areas that develop when it comes to treating infertility.